Okay, so how, as a Christian, how do I, if I have those symptoms, I struggle with those issues and stuck in a situation for quite a while, and I really want to find a solution for my condition, for my mental health, and to be healed from the past trauma. So how do I know if I need medications?
Yeah, this is a very important question because we have no test. You see, there's in most things in medicine, we have a test or an X-ray, and that will tell us if you're low in something, like if you're low in thyroid or your blood sugar is off. We have a test, and that will tell us if you need treatment. But in mental health, we have no such test. So that's why people argue about it all the time, because there's nothing black and white about it. So here's the criteria that I have found to be extremely useful, which I teach in our seminars, on how to tell if you need medications. So I like to think that your mood is a spectrum, or it's like there are extremes of mood. So what we want to be is in the middle. Okay, so every normal person has fluctuations of mood. Okay, that it all depends on your day. So you can be happy and sad depending on the circumstances of your day. And we call mood normal, at least in my definition, if you are able to be happy and sad, but control your thoughts. In other words, you can turn off the thoughts you don't want and turn on the thoughts you do want. And as soon as you lose control of your thoughts in either happy extremes or down extremes, then you've now drifted into what we call chemical imbalances. And so if we're talking depression, if you're at the low end of normal, we call that discouragement. So everybody gets discouraged. And so discouragement is a normal part of life. So that's a low mood with a clear mind. I can control it. I can shut it off. I know I'm upset about that issue. And whenever I think about that issue, my mood drops, but I can go and do something else. But in depression or a chemical imbalance, you slide across that barrier, and then you're down, sad, negative, worried, and you can't stop it. It becomes like a continuous recording of negative, anxious thoughts that are always in front of you and you cannot get away from. And if that's gone on for months or years, then, in other words, not just a few weeks, if that's gone on for long periods of time, that's a sign that your serotonin level is low, and medicines can actually correct that. It's also true at the other extreme. If you get so excited, so pumped, and you can't slow down, well, then you might be drifting into mania or hypomania if you can't shut it off. So the key is, if you're getting thoughts you can't shut off, then medications can give you back that control. So in trauma, of course, you have these traumatic memories and flashbacks that you can't stop, can't shut off. Well, that's where medicines can be really helpful.
Very good, very good. So also, as you were talking about, I think about my clients, sometimes people, they're not just have a PTSD condition, they also have ADHD or OCD, or you mentioned about, those kind of extreme situation. And that's, definitely the treatment for sure.
Yeah, there are medicines that can help any of those conditions, because what they all have in common is you can't shut your mind off and clear your thoughts. Medicines can be really helpful there. And here's just a little tip for the people watching who have a mood problem, because 20% of the population is struggling with their mood and has a low serotonin level, is that we've found that if you eliminate caffeine from your diet, then you can have better thought control and the medications will work better at lower doses. And patients taught me this, that they found that caffeine, because it's a stimulant, it takes all your bad thoughts and makes them louder and faster. And so it's harder for the medicines to help calm that down, is because everything's been ramped up. And so we just found if you get off caffeine, your anxiety, depression is less, and the medicines work better.
Good tip, very good tip. So remember, if you're taking medicine, don't drink coffee or tea.
Well,
Decaf
is fine. Decaffeinated is fine.
Yeah. Okay, good.